Okay, this is the TENSMED 931, so we're gonna turn it on by pressing this. And then to change the program, you change this, you press this here. And then since we're doing pain relief or TENS, we're going with program S. Then to change the parameters, you're gonna long press the menu button. Then since we're doing TENS or pain relief, it's 80 to 100 hertz, so you could change it here. Let's go with 110. Then for the pulse duration, it's 50 to 80. But since it's only 50 to 100, let's stick with 50. And next, I keep it continuous like that. Anyway, next for the minutes, it's 20 minutes. So after that, you long press it again, and then you're ready to press increase and decrease. Next, we're gonna do ES to retard atrophy. So first, we're gonna do program letter T. Oh, I just passed it. Okay. We're gonna go back. We're gonna press this for program T. Okay, next we're gonna change the parameters. So we need only 1 to 10 hertz. So we're gonna change it. Oh, takes a long time. Okay, then next we need 125 to 350 for pulse duration. So we can keep it like that. Okay, and next, we're gonna keep it like that. And then for the time, I know it's 5 to 10 minutes, so we could keep it like that. Okay, then press increase. For NMES or FES, we'll start and set it to program F or G. Let's do G. Then long press menu to change the parameters again. So for frequency, it's 30 to 50 hertz. We can leave it there. Then for pulse duration, it's 125 to 350, so this is fine. Then we're gonna keep it at whatever that is. Then for the time, let's do 10 minutes. Then here you could switch between synchronous or alternating, so we're gonna choose that one. For ramp up, we're gonna go with 2 seconds. Then for on time, we're gonna do 6, because the ratio is 1:3. Then we're gonna do another 2 seconds for the ramp down. For the off time, we're gonna keep it at 10. And then 0 seconds for whatever that is. So we're ready. So for the patient instruction, since we have this one plugged in, we're just gonna turn this up. And then when Kent feels the electricity, Kent is gonna step. Okay, so let's try. So this is for 10, so to turn it on here. So PP1 is TENS, PP2 is ES, PP3 is NMES or FES. So we're gonna long press this. It's supposed to say P, but it's already rubbed off. So you hold this. Then, okay, so we're good with PP1. Then next you can choose between continuous and interactive. We're gonna keep it at continuous, then press next here. It's already C. Then, so for the frequency, it's 80 to 120, so we can keep it like that. Then this is 50 to 80, so we'll bring it down. Okay. Then for the time, pain relief is 20 minutes. Oh. Okay. Then we could start. And we're putting the electrodes on his back for LBP. And take note that this is positive, negative, because they can't cross over.
Yes, sir.
Okay, this is the new machine. So to turn it on, you press the OK. And then you're gonna hold the function key because we want to make it PED1 for pain relief. So PED1 is for pain relief, PED2 is for ES, PED3 is for FES and NMES. So since we're doing pain relief, we're gonna keep it at PED1. So long press OK. Then for frequency, it's gonna be 80 to 120, so we can bring it up a little bit. Okay. So next for pulse duration, it's 50 to 80, so we could keep it there. For time, since it's pain relief, it's 20 minutes. Okay, then you bring up the intensity on both sides to start. And how to turn it off, you just long press OK until it turns off. Okay. Sabi ni Sir Mark, S for sakit, T for twitch, and G for galaw. Galing. So for pain, for example, this is the painful spot. You can do the sandwich method where you sandwich it like this. So the pain site would be here. So you could also do it on top like that, but Sir Mark said that the sandwich method is more common. Then for motor, it's going to be longitudinal, and you put it at the origin and insertion, so far from each other. You're going to start by pressing the on button on the top of the screen. So then you're going to go to ultrasound, because that's what we're going to use. And then you could press next here. Okay, for frequency, 1 is for deep and 3 is for superficial. For lat epi, we're going to do 3. Ayan, next. And then for duty cycle, 20% is acute, 50% is subacute, continuous is chronic.
Yes.
Okay, Okay, then next we change the intensity. So 0 to 1.5 is for superficial, and then 1.5 to 2.5 is for deep. So for that epi we'll do 1, yeah, 1's fine. And then the time is gonna be 5 minutes. Okay, and then make sure that you take off the cap of the ultrasound head, and then before putting it on the skin of the patient, the machine won't start unless the ultrasound head is fully in contact with the skin, like that. Okay. Bye! Okay, so to start, for this machine, it's already automatic, so you're not the one who has to pump it or whatever. It will pump it by itself. So for this machine, you only have to set the treatment time and the pressure. For the treatment time, it's 20 minutes, but you can add an additional 2 minutes for inflation time to allow the sleeve to inflate. But since this machine only allows intervals of 5, 25 is fine. And then for the pressure, for upper X, it's 40 to 60, so it will be 40 to 60. And then for the LE, it's 60 to 80. And we have to make sure that you have to take the blood pressure of the patient and make sure that the pressure does not exceed the diastole of the patient. So if Mo was low blood and his diastole was 70, then it cannot exceed 70. Then next for the modes, first I'll explain lymphogradient and then wave, so these two first. So for lymphogradient, if this is my arm, it will start, for example, if this is my whole arm. So it will do the proximal segment first. So it will do my upper arm first before my lower arm. So it will focus here first, and it will go like that. Okay, then after doing the whole proximal segment, it will then switch to the distal segment, and like that. The movement is always distal to proximal. So to recap, yeah, it'll start in the proximal and then distal. Okay, then next for the wave here, instead of doing the proximal compartment first, it'll do the whole arm now. So distal to proximal like that. Adding to what I said before, I already explained the lymphogradient and the wave. This is the same thing, it just has pre-therapy before the word. And pre-therapy means that it's just like, it gives the patient like a warm-up, and you give it to patients who are like sensitive, so it like warms them up, like it applies a little bit of pressure first to get them warmed up to the IPC. And so after putting a pillowcase around Mo's leg, we're gonna put the IPC sleeve. And zip it up all the way.
Hello.
Okay, press on in the back. Then the password is 1234. Load program. And then select by turning the wheel.
Cute yung 1. Yung 2. Chronic. 2 mo.
Okay. Enter.
Preset.
Okay, so it's already preset. So then after that, you pick up the laser and then you point it at the test site, and then you can press this to start. And make sure to finish the time while testing. Okay, so it says laser activated. Okay, then you could put it on the patient now. For example, my leg is elevated. So you're gonna press the button on the machine again. And then cover it with a towel so your patient doesn't become blind. And then you turn it off again by pressing the button. Then we're gonna do the low back again. And make sure you have at least 2 layers of towel, so I folded it now. And you should do proper draping, but we didn't do proper draping. Okay, so now to the machine to turn it on. And then we're gonna set the time. Usually it's 20 minutes, but we need to allow the machine to turn on or to heat up properly. So we can do 21 or 22 minutes. Let's do 21. And then to turn on the intensity, you press this. And then make sure that the head of the microwave diathermy is at least 2 to 3 inches. So we can put it about here. Okay? So then after that, you're gonna turn on the intensity. So I'll turn it this way. Oh, this way pala. Ayan, on. It was off, then I turned it to on. Then I'm gonna slowly increase it. And I'll ask the patient, how is the heat? Ken? It's only small. On a scale of 0 to 10, how hot is it? 1 pa lang. Okay, so we're gonna turn it up. Then after 5 minutes, you're gonna lift it up and then check the area for blanching. So how I'm gonna do that is lift up the towel, then I'm gonna blanch with my thumb to check if it still returns to its color. And it does, so it's fine. Then you can wipe the sweat then. Okay, so to guide them, you're gonna make sure the hand goes like that and not straight to the bottom, because it should not touch the bottom of the tub, so it's gonna be going like that. And make sure that the fingers are separated.
2, 3, go!
Okay, then after wrapping it in wax and stuff, you're gonna put the hand here with wax paper on the inside for 20 minutes. Turn it on here.
Yan. That is the, so that will be the pull force. O, ilan siya yung na-compute nyo?
3.7.
Round off?
3.4.
4. Ano ang maximum natin sa initial treatment? 3 to 4. Okay? Gano'n nyo katagal gustong i-hold yan? Average natin is 8. So yung next button na katabi niyan, yan, 8 natin. Okay? So of course gusto natin sagad na pull, yung gitnang button. Sasagad lang natin yan. Para yung buong 4 na yan, mahila siya. Okay? Now, yung release, gaano ka layo ang i-release natin? Correct, it's half. Ano yung half ng 4? 2. So what that? 2. Gaano katagal? 8 seconds ulit. Then gaano katagal yung treatment time natin? Ilan? Ang average treatment time ng lahat ng modalities, halos lahat ng modalities ng PT is 20, except for laser, ultrasound, and shockwave. And make sure muna yung tag niya sa bata pa din.
Okay, so here, this one supports the pelvis, and you have to make sure that this strap here is in the center. You should make sure. And then here, if it's a woman, you should put a towel for her breasts.
Nakalak na siya.
Here, there's one that's supporting the pelvis, and you should make sure that this is in the center. And then there should be a towel here to support the chest and stomach. Then here, also, you can put a pillow for women. And then yeah, this one supports the chest. Then here, make sure that the patient is strapped into the bed.
Yung sinasabi ko kanina,
You can adjust the height of this using these knobs here. Hook the traction machine to
so this is
this.
the extender. Asan yung ano yan? Okay. Usually minsan isa lang yung ganito, pero pwedeng dalawa. Attach lang. Make sure na secure nyo lang. Tapos if you remember kanina sinabi, di ko na sinabi, at least may 1 foot dito. Ayaw natin na ito masyadong malapit o dito. Why? Pwedeng maipit dito, hindi na magpupul. Same din, minsan nagagawin nila sobrang haba na extender. Ang mangyayari naman, ito nandito, tapos yung extender nandito. So pag nag-pull yan, sagad na. Okay? Ano mangyayari pag gano'n? Pwedeng masira yung machine. Okay po? Second most common na mali, nakaganyan po yung pulley. Kaya nga ang daming gasgas. Dapat nakaganyan siya. Das na nagkakamali ang mga tao, pag ini-start na nila, nakalak pa din yung this one. Okay? So adjust para makalipat na kayo. Okay, you do the manual. This is continuous, this is intermittent, this is intermittent going, increasing, intermittent, decreasing. So gusto natin intermittent. 50%, anong initial treatment? Hindi 50%. Ilan? 1/3 of the body weight. Anong weight siya?
71.
23. Di 23. Okay? So 23, ilang seconds hold tayo? 8. Yung ano natin. Minimum force yung release natin, half of the 23. Ilan? 11.5. Okay? Oh, release natin. 8 din. Ito, multiplier to. So ilang beses babalik akyat. Dapat at least sumabot ng 20 minutes. Siguro mga 52. Or masyadong marami. Okay. Ito yung force na yan. Keep it at this. Yan na yun. You press start. This is the start. Okay? Unlock nyo muna. This is the unlock. This is the unlock. Okay? Oh.
Hi, it's Isabel. So I just wanted to come on here and say that this video was really only supposed to be for personal use, since I wanted a video on physical modalities that I could refer back to in the future, but I decided to share it publicly just in case any other physical therapy students like myself or students from other courses may want to use the video too. So I hope this helps, and thanks and enjoy!